Okay, perfect. I think we can go ahead and get started. Thank you all for joining. Today we have the great honor and privilege of having Miss Michelle Gydesen with us. Michelle Gydesen is a lifelong never smoker and was diagnosed with non-small cell lung cancer at the age of 32. And 14 years later, she received a second lung cancer diagnosis. But since then, she's had clean scans and living each day to the fullest. And last year, she celebrated her daughter's college graduation and son's high school graduation. So congratulations. And this fall, she and her husband will celebrate their 30th wedding anniversary. And she's joining us today here with the American Lung Cancer Screening Initiative to share her story. So Michelle, thank you so much for your time and your willingness to be here with us.
Oh, you're welcome. Thanks for asking me.
Thank you. So before we continue, we just want to launch a quick poll to get a feel of the audience we have today. And so I'll launch the poll right now. There are two questions just asking about how much you know about lung cancer and lung cancer screening. So, and I'll share the results of the poll once we get a few responses in. Okay, awesome. It looks like we have everyone's responses. So here are the results. A lot of people know a little bit about lung cancer and a lot about lung cancer screening, which is awesome. And so that's great to hear that people have heard about lung cancer and lung cancer screening. That's what our organization is all about. And so we can share more about our organization in just a little bit, but it's great to hear that, and hopefully through this presentation, we have a few slides in the beginning, and through Michelle's story, hopefully you'll be able to learn more. And so to introduce myself first and my team, my name is Priyanka, and with me I have Drake and Anish, and we are part of the American Lung Cancer Screening Initiative. And I'll just share my screen with some slides about who we are. Okay. Can everyone see my my slides okay? Okay, awesome. So ALCSI is a 501c3 nonprofit that works to raise awareness about lung cancer screening. And we are a team of over 200 students and doctors located across the United States. And we do the work that we do because lung cancer is the deadliest cancer in the world, causing more deaths than breast, prostate, and colon cancers combined. Lung cancer causes about 380 deaths per day in the US alone. And it's very fatal because currently many patients are being diagnosed at a late stage when the cancer has grown and spread to other parts of the body. And lung cancer is an effective imaging technique that can be used to screen for lung cancer and has shown to catch lung cancers early. However, less than 6% of people at high risk for lung cancer are currently getting screened. And the screening rate for lung cancer is much lower than the screening rates for breast, cervical, and colon cancers, which are about 70%. So we believe that educating people about lung cancer screening is one of the most important and effective ways to increase the lung cancer screening rate for populations that would benefit from lung cancer screening. And so far, we have given over 100 presentations on lung cancer and lung cancer screening to universities, hospitals, medical schools, and organizations around the US, as well as India, Canada, Brazil, and Mexico. And so far, we've reached over 10,000 people. And we've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as several city and state health departments, including the New York City and Connecticut health departments. And over the last year, we worked with 105 mayors from every single US state to issue proclamations recognizing November as National Lung Cancer Awareness Month. And we've also had the opportunity to work with several leaders at the state level, including Arizona State Senator Leila Aston, who is a lung cancer survivor, Pennsylvania Governor Tom Wolf, and the Lieutenant Governor of Colorado, Diane Primavera. In addition to our education, outreach, and advocacy efforts, we've recently started a podcast series to share the personal side of lung cancer and provide a platform for lung cancer survivors and advocates to share their stories. And last fall, we worked with U.S. Congress members and senators to draft and advocate for the first ever House and Senate resolutions recognizing the importance of early detection of lung cancer through screening. And in December 2020, the Senate resolution was passed with unanimous consent, marking this the first time the U.S. Senate has ever recognized the importance of screening. And ALCSI has been actively working with Representative Brendan Boyle and Senator Tina Smith to draft and advocate for Catherine's Law for Lung Cancer Early Detection and Survival Act of 2021. And so lastly, I just want to talk about lung cancer screening. So lung cancer screening is done using low-dose computed tomography, which is a scan that uses low radiation doses, is pain-free, and takes less than 5 minutes to complete. And the United States Preventive Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. And right now, they recommend that people between the ages of 50 and 80 who have a 20-pack-year smoking history or more, and who are current or former smokers who quit within the past 15 years get annual low-dose CT scans. And 1 pack a year is defined as smoking on average 1 pack a day for 1 year. And so 20 pack years can be met in several ways, such as smoking 1 pack a day for 20 years or smoking 2 packs a day for 10 years. And so if you know anyone who might be eligible for lung cancer screening based on the criteria that we just talked about, we really encourage you to please share the link given by the QR code so that they can get in contact with one of our doctors about lung cancer screening, and we're happy to help. Great. Well, thank you all for listening to that presentation. And without further ado, we can jump right into the podcast. We have a few questions prepared for Ms. Gydesen, but we also have a Q&A session at the end where you guys can submit any questions you have for Ms. Gydesen. And this podcast is being recorded and will be shared on our YouTube and social media pages. So Ms. Gydesen, I just wanted to ask you if you could please introduce yourself and just share any background that you'd like everyone on the call to know.
Sure. My name is Michelle Gydesen. I've lived in Minnesota all of my life. I'm married to my husband, Chris. We have 2 grown children. Rachel is 24 and Henry is 19. So we're adjusting to being kind of empty nesters. Henry's home from school right now, but we'll be going back in the fall. For the past 26 years, I've worked for an integrated nonprofit healthcare provider and health insurance company. I enjoy volunteer work, spending time with family and friends, going for long walks. And last year, I started playing a little bit of pickleball with some friends. So just like to enjoy every day.
Awesome. Thank you.
Great to hear. Depending on how much you're comfortable sharing, could you please tell us about your experience when you were first diagnosed with lung cancer?
Sure. It was in the spring of 1999. I came down with a case of pneumonia, so I went to my primary care doctor and I was prescribed a round of antibiotics, and I started taking those, but I wasn't feeling any better and I was getting worse. So I went back to the doctor and he ordered a chest x-ray, and then he provided me with some more antibiotics and an inhaler for my cough and said to come back after the antibiotics. After I finished that course of antibiotics. And I was feeling better. I felt fine, but the doctor told me to go back for another chest x-ray. So I did. And there was still a residual amount of what looked like pneumonia, which should have been gone by now. So at that point, they sent me to a pulmonologist. And then over the course of 6 months with that pulmonologist, they did follow-up CT scans, another round of antibiotics, thinking this was a slowly resolving pneumonia caused by an unusual organism. And they eventually did a CT guided needle biopsy, which is what confirmed the cancer. And they were so shocked. They didn't even believe what they were seeing. So they sent my results off to another lab for a second opinion to confirm it. They just hadn't, at that time, encountered anyone my age. I was 32 at the time.
It's very interesting that you say that Is there anything else specific about your lung cancer diagnosis that you'd be willing to share in terms of like histology, the stage, things of that nature?
Sure. The first one, they called it, they don't use this term anymore. They identified it as bronchoalveolar cell carcinoma. It was back. So it grew in the bronchial tubes. So it looked exactly like pneumonia. They weren't sure exactly how to stage me because it didn't fit quite right. They called it a 3B. It hadn't gone to any lymph nodes, but it was also kind of all over the place in my lower lobe of my right lung.
Very interesting. Thank you. And I just wanted to ask, what was going through your mind when you first received your diagnosis, and maybe what were some of like the first questions that came to your mind when you received that?
How? The year prior to my first diagnosis, my dad was diagnosed with lung cancer, and my dad was a smoker. But interesting with his as well, his was an adenocarcinoma. They said it's not the typical kind that smokers get. So I was just wondering, well, how in the world did this happen? And I didn't know anyone my age at all that had this. I went to a lung cancer support group, and I was the youngest person in the room, and they all felt really bad for me because they said, I sure wish you could talk to someone closer to your age. I just couldn't find anyone back then.
Yeah, it's so interesting that you mentioned you were the youngest lung cancer person in the room. How has your lung cancer diagnosis affected you?
Oh, it sure put everything on hold. In 1999, our daughter was only 22 months old. We were ready to add on to our family, and we couldn't. I had to undergo CT scans every year. So they kind of wanted to get a number of those done before having more children. I had one oncologist who said, you want to have more? Seriously? It's terrible bedside manner. But then after 5 years of CT scans, they told me not to get them anymore, because the thinking at the time was I was so young and that I shouldn't have all that cumulative radiation over the years. So I just followed up with chest x-rays. So about 3 years into my recovery from that first diagnosis, we were able to have another child, and that's when we had Henry.
So it clearly requires a lot of strength and fortitude to do this, but what would you say motivates you to share your lung cancer story so publicly?
I want to offer hope to other survivors. I travel back in time, and I wish I could have met someone that's survived lung cancer 20 plus years. And I also want to stop the stigma. I want to put a face to lung cancer to stop the stigma. There's so much focus on prevention, that you can prevent lung cancer, and that is deadly. That thinking of you can prevent it, it leads to, there's no screening for this for someone like me. There isn't any. And then oftentimes they're diagnosed with bronchitis, and they're given inhalers, or you're given antibiotics. Everyone I meet is stage 4, usually stage 4. And they all have, like ALK mutation, which, by the way, my second diagnosis was adenocarcinoma. It was also a stage 3, and it was an ALK mutation. But luckily I could have surgery the second time as well. So.
You mentioned that you received surgery. I was just wondering if you could talk more about that process, treatment looked like,
Yes.
following up to it, and maybe after as well.
Yeah, so big difference between surgery 1 and surgery 2. My first surgery in 1999 was a thoracotomy. Very painful, long recovery period. They removed the lower lobe of my right lung. And then my second surgery, I was so relieved to hear they had made progress in lung cancer surgery. So the second surgery was a less invasive procedure called VATS. What is that? Video assisted thoracotomy surgery? Okay. And so I had a quicker recovery period. It was amazing. I didn't have the big, huge scar across my back. Didn't go through all the nerves. Don't have any pain from it at all. So that was a much better experience. I did have lymph node involvement on my second lung cancer diagnosis. So I had 4 rounds of chemotherapy. But between the 3rd and 4th round, I had a port that became infected. So I had a raging staph infection, and I landed in the hospital for 11 days and sent home with a PICC line and had to do 6 weeks of IV antibiotics. So after healing from that staph infection, I was able to finish my 4th round. And I've had clean scans ever since.
I assume that this lung cancer diagnosis came as a surprise. So did you have any misconceptions about lung cancer prior to being diagnosed?
Oh, absolutely. I mentioned the year prior to my first diagnosis, I saw my dad go through the lung cancer surgery, and it looked so painful. And I thought to myself, while I'm visiting him in the hospital, I am so glad I never smoked. I will never have to go through this. And then a year later, I was going through it, and I had never smoked. So I was one of them.
What would you say are some of the current challenges that the lung cancer community faces?
Oh, definitely that stigma that we kind of touched on earlier. It has slowed down research for the disease, focus on preventing it, preventing people from smoking, which, there's more to lung cancer than smoking. You just need lungs. So that has really, I think, held back the progress in lung cancer. A lot of people don't even know that lung cancer is the deadliest cancer that there is. There's no screening unless you're a smoker, there's no screening for it. So that's what's hard. I wish more primary care doctors would know more about it, more internal medicine doctors, because that's the first step. That's the first person you see when you're sick. And if it takes 6 months to a year to figure out what's going wrong, or, why isn't this person getting well, additional knowledge in that area. I also think it would be great, you fill out the forms at the doctor's office, like, do you have lead paint in your house? When was your house built? To making sure there's no lead paint. I'd like it if they'd ask you if you've checked your house for radon, because radon is also contributes to lung cancer.
I think those are really important areas where we really need to focus on and improving how we evaluate who needs to get screened for lung cancer, and targeting information to individuals who might be at higher risk, because like you mentioned, you never smoked. And I think a handful of patients diagnosed with lung cancer never smoked, even once in their life. And there's definitely been a large emphasis on the correlation between smoking and lung cancer. And while smoking is still the primary cause of lung cancer, there are several other risk factors for lung cancer, like exposure to secondhand smoke or exposure to radon, asbestos, and even like COPD. And so I think it's really important that we raise awareness about these other risk factors as well, and that we move away from this correlation between smoking and lung cancer, because lung cancer can be caused in many different ways. And as you mentioned, sometimes when there is a stigma between smoking and lung cancer, some people who are smokers and diagnosed with lung cancer might then be less likely to get lung cancer screening or seek out treatment, just due to the stigma that surrounds individuals who smoke and get lung cancer. And I think you brought up a really interesting point about tracking whether people have tested their home for radon. And I think that's a really, that'd be a critical piece of information, because individuals who live in geographical areas with more radon exposure due to the soil and just the environment might be at higher risk. And so identifying whether there is a correlation between incidence of lung cancer in certain areas and radon exposure could be very helpful. And I think even a simple thing like tracking smoking history in electronic patient health records, because I know not all electronic patient health records track smoking history. And so if we're able to track smoking history and have a banner or something pop up so that physicians are alerted when someone meets the lung cancer screening criteria, that could be very helpful. And right now, as we talked about the lung cancer screening guidelines, so right now the lung cancer screening guidelines only include smokers, as you mentioned, and the individuals aged 50 to 80 years. But just more research is needed in order for us to be able to identify and create guidelines for maybe individuals who don't smoke, who would also be at higher risk. So I think just more research in this area is definitely needed and can help with that.
And family history too. I meet a lot of people that have multiple family members with a lung cancer diagnosis.
Right. And I think even working with emergency health departments could be another way to identify high-risk individuals, because for some individuals, emergency departments or urgent care centers might be their only point of contact with the healthcare system, especially for underserved or low income communities. And so if we can work with these emergency departments to identify potentially high risk individuals, I think that could be another way that we can identify more high risk individuals. And so we really admire your efforts in the lung cancer community, especially your work on Instagram and sharing your story so publicly. So I just wanted to ask if you could describe some of the things you're currently doing to help the lung cancer community.
Sure. I became involved right away from the beginning. I met with a very active group of lung cancer survivors at the time in the early 2000s. We had the first ever lung cancer rally at our state capitol in Minnesota. So that was really great. And then I've also, through a national organization, I've shared my story on Capitol Hill, pressing for increased funding for lung cancer. You mentioned Catherine's Law. Catherine's from Minnesota. She was a friend of mine. She was very involved with a local lung cancer organization that we have here in Minnesota. And I've shared my story at several of their events, and I've participated in their lung cancer walk and raised funds for lung cancer research in that realm. I had a lunch and learn. I mentioned I work for a healthcare organization. I had a lunch and learn. This was before COVID, when we were all working in a building. And I had our local lung cancer organization share information. I invited my oncologist and he shared lung cancer information, and then I shared my story. And I received so many emails after that from different colleagues throughout the organization that reached out to me, sharing their experience, people they know with lung cancer, and so excited that there's hope, and because they have a relative with lung cancer. So it's just been a very rewarding part of being a lung cancer survivor and wanting to change the stigma, is to get the message out.
Thank you so much for all that you do. I think it's really comforting, and it's special to be in a community where you might be able to meet other people who've gone through similar things that you might be going through as well. So I know that it's probably making a huge difference for people who just want to learn more about lung cancer or who are going through that journey themselves. And then lastly, just wanted to ask, do you have any advice for people looking to get involved in the lung cancer community? Maybe how they can help individuals that they know who are diagnosed with lung cancer, or just to just help out in removing that stigma or raising awareness?
Share your story. The more stories that are out there, the more faces that there are, raise it up to your legislators. We need increased funding for this disease. You need to share your story, and we need to make a change, and it's going to take a lot of us to do that.
Yeah, so thank you so much, Mrs. Gydesen, for taking time out of your day to share your story with us. It's great to hear about the impact you make, I guess, in your state and also the people that you met through Instagram and various other initiatives. I would also like to open the floor for our participants to ask you any questions they may have regarding you or your story, and if you feel comfortable answering them. So if you guys would like to ask Mrs. Gydesen a question, please put it in the chat or unmute.
I received a question from one of the participants. They're asking, had you ever heard about lung cancer screening before? And did you have any concerns about it when getting your first lung cancer screening test?
I hadn't. The very first time that I was diagnosed, I'm trying to think when that was passed. I don't even believe there was any lung cancer screening at all. And I had seen my dad go through having all these tests. So I followed like almost a year. He was in October of 98 and I was October of 99. So everything I saw him go through the year prior, I went through the year later. So I had been exposed to it. And in a way, the CT, that was fine. But facing the surgery that my dad faced was terrifying to me. That was really hard because I saw how painful it was and everything he went through, and I knew I'd be facing that.
Thank you. Another question I've received is, what did the moment feel like when you found out you were cancer-free?
It's just like a burden lifted off of your shoulders, happiness, just really soaking in and living in the moment. It was an amazing feeling.
I think we have two questions, one in the chat and Ashley's raising her hand. Ashley, do you want to ask your question?
Yeah, sure, I'll jump on in. I'm going to turn my camera on so I can make eye contact. But,
Hi, Ashley.
Hi, thank you so much for sharing your story. I've been a part of ALCSI for about over a year now, actually. And I just think it's so special to hear your story from your mouth. A lot of times we hear stories, but it's not directly from the patients themselves or the people that have lived these experiences. And I just wanted to hear your thoughts on, you mentioned how long it took for you to actually get screened and then get diagnosed, and it took 6 months and even more, I'm guessing. So what are your thoughts on that, and how do you think that can be improved?
As far, I think some education for your first connection with your primary care doctor or your internal medicine doctor. Not that everything you're going to jump to lung cancer because someone's coughing for a long period of time, but enough to know to ask some questions about family history and your house, have you checked your house for radon, any of those types of pieces, and the family history. I know so many people that have multiple family members with lung cancer. And immediately they're not offered a CT scan either. I have a friend who pushed for her CT scan, and because her dad was diagnosed, her sister was diagnosed, and then she just wanted to check. She was feeling fine and really pressed for it. And guess what? She had lung cancer too. But they found hers at stage 1 because she had no symptoms at all. She just pushed for it because of her mom and her dad and her sister.
Thank you so much.
You're welcome.
I think we have a question in the chat. Looks like it's from Rachel. She says, "Hi, Mom. How do you think I was interpreting what was going on as a toddler? I think I remember knowing Mom is very sick, but I'm curious if you remember anything else from that."
Oh, I do, because she was talking at the time. And so it was really hard to see your toddler. One of her sentences that she strung together was, "I'm going to visit Mommy in the hospital, going to visit Mommy in the hospital." So I clearly remember that when she was a toddler, and she was just blissfully happy and unaware, the seriousness of the situation. And it was really refreshing for me too, as well, because, her life was normal. Hi.
I thought I'd turn my video on.
Hi there, good to see you. Yes,
too.
she was 22 months old when I was diagnosed, and she's grown up and a teacher now. And from going from not knowing if I would see her grow up and graduate from high school to see her graduate from college and start her career makes me so happy.
Proud of
Amazing.
you, Mom. Love you.
Love you too.
That's so sweet. Thank you. Thank you both for being here. It means a lot to us. Another question I have is, what do you think are ways to spread awareness to the new generation? And the person asking is actually my brother, and he's in 6th grade. And so I think he's interested in how do we spread awareness about lung cancer and lung cancer screening to maybe middle school students, and how do we start this conversation with them?
That is a great question. I know in middle school, my son had opportunities where they got to research a topic and give a presentation, and my son was a champion of lung cancer awareness. And for his project, he picked lung cancer, and he gave a big presentation on it to the people in attendance, and it was a learning experience for everyone. So in any kind of papers, presentations, my kids would even spread awareness with their peers and correcting them that, you know, it's not just smoking that causes lung cancers, and not just smokers get lung cancer, was an opportunity. That's a great question. And I'm so happy that he wants to spread awareness.
Yeah, I think what you said is right on. If we were able to just, talk to students about lung cancer screening, even if it's not directly relevant to them at that point, if they have family members or even parents who might be at high risk for lung cancer for a variety of reasons, it could just having this conversation with the students might spark a conversation with their parents and relatives that could help them get screened or help them talk to their doctor about other options.
Yeah, exactly. And our high school is really involved with Relay for Life, and I got to share my story at their event last month. So in my community, that was another way that I was raising awareness.
Awesome. Another question I have is, looking back at your journey, is there anything you would do differently?
Oh, that is a really good question. I wish I would have followed some of the research more closely, because there was a time I felt that I kind of fell off of the lung cancer track. Everything was fine, and I was just getting chest x-rays, and I'm sure things changed over the course of time. So I kind of wish I would have, maybe double checked with my oncologist, should I come back? Should I have a low dose CT scan? Is there anything that should change over the course of all these years after I was kind of dismissed from oncology?
Yeah, and just on that topic, sometimes it's difficult to know what questions to ask. And so in a situation like that, do you have advice for anyone, going through a lung cancer diagnosis or even another diagnosis, just figuring out, what questions to ask in that moment?
There are great resources online through all of these different lung cancer organizations with helpful questions to ask. As the patient, it's hard to absorb all of the news and the information and ask the questions. So if you can have a friend or a family member go to your appointment to kind of be that interpreter and take the notes so that you can go back and look at the information. Keep track of your information. We have great tools now with the electronic medical record, which I wish would have existed back in the day. Read your scan results and look at your notes, and just be an advocate for yourself, because you know your body best.
I think I have one question. What were some of the mental health strategies you used when dealing with your diagnosis?
I did speak with the, every oncology clinic has a social worker, a counselor. I spoke with the counselor. I just really learned to live. I know it sounds cliche, but I really had to live and still do try to do this one day at a time. You don't know what happens tomorrow. Yesterday already happened. And worry didn't get me anywhere, but made me sad and hard to focus on the future. So I took it one day at a time. When I knew my plan for care and follow-up, and I had a plan in place, that really helped. And there were some breathing exercises that helped calm me, and focus and get clarity. And walking was huge for me. Love walking, and it's a way to clear my mind and be in the present. And ask for help when you need it. My friends, my family, I had a huge support network. And I relied on a lot of people when I was going through my cancer diagnosis.
So how can someone support another person who has lung cancer?
That's a good question. Listen, be a good listener. It's not that someone has to have the right words to say, there aren't any, but to really be a listener. Are you okay today? And more than just saying, is there anything I can do for you? That to me kind of put pressure on myself to think of something that I should have them do. So when a friend would say, hey, are you busy this afternoon? You want to go out to lunch? Things like that. Or would you mind if I swung by and dropped off, a treat for you? Things like that I found really helpful and supportive.
Would you be willing to talk a little bit about the process of getting your yearly CT scans? I know some people are haven't been through the process or don't know much about it, and so maybe what the CT scan feels like, how long it takes to get the results, and maybe what the discussion with your doctor is like when looking over the scans and the results.
Sure. That is also something that's changed over the years. That's really different. Well, the CT itself is really quick. It's not painful at all. It takes just minutes. I get mine with an IV contrast. That feels a little funny. It's like a warm sensation. But other than that, it's really painless. And then you have to drink lots of water throughout the day to flush the contrast from your kidneys. And now the results are released automatically in your medical record, because by law, they're your records. So before, they'd hold them until you got to talk to the doctor. So it's kind of a blessing and a curse, because you have to be prepared to open those and read them. But you can always let it sit there till you have the appointment. So in the past, it used to take a whole week to get my results. And now they come through the same night sometimes, or the next day.
What were your initial thoughts after receiving a diagnosis for the second time, knowing you've already beat it once?
Oh, that was emotional for me, because after my dad's lung cancer came back, he passed away 7 years later. So that weighed heavy on me. But my doctors always reminded me that I was younger. I have healthy, other than the cancer, healthy lungs, good lung capacity. So then I just used my one day at a time, each test, take those results, get a plan. Huge relief when I found out the surgery was less invasive. That was huge for me, because I knew that my recovery would be faster. But the real blow was finding out there was a lymph node involved, because I knew that meant chemotherapy, because that didn't show up in the PET scan. I mean, nothing. They were shocked that there was a lymph node involved. So,
Can I make a comment from
sure,
that time?
sure.
I remember feeling really scared because I'm sure you remember that was just shortly after my best friend's mom passed away from a different type of cancer. So and having more awareness at that time, it made it really scary.
And that was harder. Thanks, Rachel, for bringing that up, because Rachel was in high school and Henry was in 5th grade. And so, you know, they know what cancer is, and our community is real, as I mentioned earlier, our community is really involved in, you know, different cancer events and everything. And at that time, I know Rachel had friends over, all 4 of them had parents with cancer, you know, different types. I was the only one with lung, but so yeah, that was scary. It was a whole different experience having kids that knew what was going on.
If you're comfortable answering, could you please talk about your chemotherapy experience?
Sure. I had, I'm trying to remember the names of the drugs. They were cisplatin and Alimta, I believe was my combo. One was a really quick delivery. And then the other one, I think I felt like I was there half a day for the drip. I was really tired, and they controlled the nausea really well. I would go in the day after and get fluids, IV fluids after my chemotherapy. So that was great. So I didn't have the nausea or any of that. You really have to, the constipation, I think nobody wants to talk about it, but that was a huge side effect. So you have to kind of figure that thing out, and how much you need of laxatives for that. But once I got that system down, you know, the first 3 were fine, but then, you know, having the staph infection really threw a curveball at me. So I was faring the chemo okay. I would have about a week of feeling kind of lousy, and then I was okay.
And a personal question that I had was just, how did you talk to your kids, or how would you like suggest that other parents talk to maybe their kids, whether if they're little, especially about a cancer diagnosis?
Oh, I know. I wish I would have people to talk to at the time and get all the right things. We just told them that I was diagnosed with cancer again. I had had it years ago, and they were, you know, my doctors were confident that I would be okay after my surgery, and just encouraged them to ask questions. I don't know if I handled it right or not, you know, but just trying to tell them about it and then what was going to happen. And there's Rachel again.
I was gonna say, when you sat us down though, first you just were really vague, like we need to talk to you about something, and I was afraid you guys were like getting a divorce or something. Like I was not expecting the cancer. That was like not what I expected. Not that I'd expect. I didn't know what to expect when you guys just were like, oh, we need to talk at the kitchen table. It was scary.
Yeah, well, it was for us too.
Mm-hmm.
Thank you. I think a couple of questions coming in. During your journey or your father's loss, what kind of helped you get through that?
Really connecting with lung cancer survivors. We have similar experiences. I know a lot of people with lung cancer that have lost parents to lung cancer. So there's a real connection there, and a great support network. And again, leaning on family, friends, and then a lot of we are members of a church, and a lot of friends from our church too are very supportive.
I think that wraps up our Q&A, but if anyone has any additional questions, please feel free to just type it or unmute. I'm not getting any on my end, but if anyone has any questions, just feel free to butt in at any time. So thank you so much, Mrs. Gydesen, for your willingness to share your story and perspective on many of the pressing issues in the lung cancer community. We appreciate the work that you're doing to help raise awareness about lung cancer. And thank you everyone for joining our podcast. Please keep an eye out for our upcoming podcasts and events, which will be listed on our website, www.alcsi.org. We also encourage you to join our monthly newsletter where we share updates on upcoming projects within our organization. Please fill out this Google form if you would like to be added to the mailing list. And before we end this, we would also like to offer a brochure highlighting some key information about lung cancer and lung cancer screening. If you find this helpful or know of anyone who might benefit from the information included in the brochure, feel free to share it. Thank you, everyone, and have a great day.
Bye. Thanks, everyone.
Bye. Thank you.
Bye.
Thank you everyone for joining, and thank you again, Ms. Gydesen, for your time here. It was a pleasure talking with you.
You're welcome. Thanks. Bye.